When you think of pain, it's immediately associated with an unpleasant sensation. But feeling pain is actually a necessary experience. It alerts you to a potential illness or injury that needs to be addressed. On the program today, we'll talk about the different kinds of pain and how to manage and treat them effectively. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. Pain is a sensation that's triggered in your nervous system, but pain varies according to each person's tolerance and threshold, and it also depends if the pain is acute or chronic, and understanding the two can help you better manage pain. Let's welcome our guests for today. We have with us Dr. Filipinas Ganchun. She's a rehabilitation medicine specialist and immediate past president of the Philippine Academy of Rehabilitation Medicine. Also with us is Dr. Glenys Nocumfong. She's an anesthesiologist and pain management specialist at the Medical City. Now, some people experience more pain than others, and that's because everyone has a different tolerance as well as threshold for pain. So it's very subjective at times to really determine how painful something is to someone. What's the difference between pain tolerance and pain threshold?
Yung pain tolerance, that is your capacity, yung pasyente, yung makayanan niyang pain. So that is tolerance, and it's dependent on your pain threshold. Yung pain threshold, yun po yung point na naramdaman niyo yung pain. So kung bawa may pressure po sa kamay mo, kahit matagal na po yung pressure, hindi niyo pa rin maramdaman, ibig po sabihin nun is mataas po yung pain tolerance nyo kasi mataas po yung pain threshold nyo. So yung pain tolerance nyo po is dependent on your pain threshold. So kung yung pain threshold nyo po mababa, maliit lang na sakit, nasasaktan ka na. Pero kung mataas yung pain threshold mo, kahit grabe na yung sakit, minsan hindi mo pa manaramdaman.
Your pain threshold is when you begin to sense the pain, prompting you to pull your hand away. Now, kay Dr. Glenys naman, bakit iba-iba ang pain threshold and pain tolerance ng mga tao?
One factor, of course, would still be genetics. But pain also, if you remember, is not just physical. Kasama rin yung emotional, yung psychological, and social, and even the spiritual component. So it will vary with the person.
So malaking factor din pala yung interpretation natin with the pain that is being felt based on that. Now, someone's tolerance and threshold for pain can vary based on many factors, as was discussed, and your genes and sex both play a role in how you perceive pain. Now, women usually report higher levels of pain than men, and even your experience, your emotions, and lifestyle can factor in your tolerance for pain. Dr. Glenys, are there things that someone can do para tumaas yung kanyang pain tolerance?
Aside from the physical component, so yung psychological, social, and spiritual. So if you notice, if we were, somehow, example, we are able to manage our stress during the may i-injectionan ka, and you are able to calm yourself, deep breathing exercises, it will help you also increase your pain tolerance, mas kakayanin mo siya. As opposed to a person who nagpapanik at kasimulat pa lang parang talagang malungkot na, hindi na nila kakayanin. That's why we also, the social aspect and the spiritual and psychological is also important.
Now, we all know that regular exercise has many benefits. It helps control our weight, reduces the risk of heart attack. But, Dr. Pinay, how does regular exercise, especially one in particular, ang yoga, help increase yung tolerance natin for pain?
Okay, so exercise in general is known to improve our pain tolerance. So, mas nakakayanan natin yung sakit pag nag-exercise tayo. Kasi pag nag-exercise tayo, nag-improve yung circulation, lumalakas yung muscle, nag-improve yung flexibility. So, na-address po yung causes ng pain. Kasi kung minsan yung pain could be due to circulation, it could be due to muscle weakness, panghina, it could be due to inflexibility. So, yun na-address ng exercise, and particularly yoga. It also, ang yoga, involves strengthening, so pinapalakas ka niya. Secondly, ini-improve na yung flexibility mo. And thirdly, when you assume certain postures in yoga, nawawala yung mind mo dun sa sakit kasi nakafocus ka dun how to maintain the posture. So that's why the yoga is very good also in addressing pain because of addressing the mind issue.
And there's actually some research na nagpapakita that yoga can help people manage arthritis, lower back pain, and many other types of chronic pain conditions. We'll talk more about ways to cope with these chronic pain conditions later on the show. But for now, a higher tolerance for pain can be useful. Pain is still an important reaction ng katawan natin. Again, feeling pain warns you about potentially harmful and dangerous injuries or illnesses. While it can be good that someone has a high pain tolerance, it can actually be problematic. Dr. Glenis, let's explain how a high pain tolerance can be problematic.
We have a high pain tolerance, so technically, nakakayanan natin. Pero I know that sometimes nakakayanin to the point na tinitiis na natin, which should that be? Or hinahayaan na natin kasi sabi natin kaya ko pa. Remember that as you said, na pain is a warning sign. It's a way our body communicates to us that there is something wrong. So pag hinayaan natin, pag tumagal siya, nagiging chronic, like it happens for a longer period of time, it doesn't go away. We might be ignoring some health problems later on.
Yes, that's correct. And recent studies actually showed that people who have high pain tolerances are at an increased risk of silent heart attacks because they won't be able to notice some of the obvious symptoms. So
Yes.
if you have an exceptionally high pain tolerance, it might be time to schedule a checkup with your doctor. From headaches to muscle pains, these are the common everyday pains that can impact your day-to-day. We'll discuss the tried and tested ways to manage these after a short break. Stay with us on MedTalk Health Talk. We are your partner in healthcare. You're watching CNN Philippines. Welcome back to MedTalk Health Talk. I'm Dr. Freddy Gomez. Whether it's a headache or muscle pain, almost everyone experiences these common everyday pains. And we often don't realize how much they can actually affect a day's work. Finding the right relief from these pains can improve your everyday life. We'll discuss some of the ways. Now, one of the more common pains, if not the most common pain we experience, is a headache. Now, Dr. Pinay, what happens when someone experiences a headache? Walk us through some of the different kinds of headaches.
There are primary headaches na this is yung dahilan ng headache mo ay dahil talaga sa sakit sa ulo, sa parte ng ulo. Or meron secondary headaches na ito ay dahil sa sakit sa ibang parte ng katawan, meron kang infeksyon o may ibang sakit sa katawan na naapektuhan yung ulo mo kaya naramdaman mo yung sakit. So yung most common na primary headache is tension headache, 'di ba? Kung marami kang ginagawang trabaho, may mga deadlines ka, mararamdaman mo talaga na sumasakit yung ulo mo lalo na dito sa forehead, sa upper back area. So sumasakit lahat 'yan. It's because of the tension. So ito ang pinaka-common na headache, but other more serious causes of the headache that could alert you na it could be serious if the headache is severe, nagsusuka ka or nahihilo ka or nawalan ng malay kasi ito ay serious na headache at dapat ikonsulta ka agad sa doktor kasi baka hindi lang ito simple na headache, baka ito ay stroke or iba pang serious na kondisyon.
Now, knowing your own triggers and listening to your body can help you best prevent headaches. Another common pain we all experience is muscle pain. Dr. Glenis, ito naman yung tanong para sa'yo. Can you explain to us what a muscle pain is and why this happens?
Muscle pain, of course, is a type of pain that it's coming from the muscle. So it originates in our muscular skeletal system. So it is often related to tension. Yun nga yung Minsan yung talagang nangawit na from typing sa laptop all day or sa desktop, or it can also be overuse from too much physical activity or strain or even sprain if there's an injury to the muscle.
That's right. So marami talagang pwedeng causes din ng muscle pain. It can also be a symptom of an infection like the cold or the flu. So if it's accompanied by other symptoms, please call your doctor right away. Now, the good thing about muscle pain is that they respond well to some home treatments, like resting your muscle when you're experiencing pain can help with that, and applying the right compress. But many often confuse whether to use warm or cold compresses. Dr. Piray, kailan dapat gamitin ang cold compress?
So if your muscle pain is acute, so within the first 48 hours, so you can use the cold compress. And usually we apply it, you can use an ice pack, and you wrap it with towel, and then apply it for 20 minutes, not more than that. And make sure that you don't apply it directly on the skin to avoid any frostbite. And those who are extremes of age, the very old or the young, they have thin skin and sensitive skin. So if you apply more than the duration of 30 minutes, and if you apply it directly, it might cause more harm. So we suggest that you apply it for 20 minutes and wrap the ice pack with a towel, 1 or 2 layers of towel.
Okay. Now, Dr. Pinay, anong pinaka-goal natin with the cold compress? What is it trying to achieve in our body?
So the cold induces vasoconstriction, and it decreases the pain. So it decreases the swelling. So when yung dugo na pupunta dun sa area na damage or na-injure, binabawasan mo, so yung chance na mamamaga is less. So pag less yung pamamaga, yung chance na maramdaman mo yung sakit, mas less din po.
Ayan, okay. So klaro na yon when to use the cold compress. Dr. Glenis, when should someone use the warm compress naman?
Warm compress kasi ang warmth increases the blood flow. So it can be used for areas na pagising natin, medyo stiff yung mga kasukasuhan natin. That may help. Kasi hindi naman siya yung acute injury per se. Yan yung talagang kailangan na natin siyang pagalawin.
The heat should not be used for those with acute injury because like ang sinabi ni Doktora is the cold is what we're trying to minimize the inflammation with. Warm compress shouldn't be applied in areas in question if it is bruised, swollen, or there is an open wound for that matter.
Right.
Now, Dr. Pinay, let's talk about naman yung mga over-the-counter medications used in order to manage pain. And specifically, let's talk about yung mga NSAIDs or yung non-steroidal anti-inflammatories. Kailan ito best gamitin?
So usually we use it only when there's acute injury during the first 5 to 7 days. And if there is significant swelling or inflammation, because if there's only mild to moderate inflammation, our ice compress or cryotherapy can deal already with that.
Okay, now ang question ko naman is kay Dr. Glenis. Anong mga risk factors naman whenever some of our viewers might keep on taking itong mga NSAIDs with the slightest form of pain? What are some of the risk factors na dapat silang aware whenever they're taking medications for simple acute pain?
Yung mga over-the-counter medications such as the NSAIDs that you mentioned, if we take it for a longer period of time, can affect our stomach, yung pangangasim ng ating tiyan, which can also lead to bleeding. At it can also affect our kidneys. Tama si Doktora Ganchon na up to 5 to 7 days lang sana siya gagamitin, not beyond that.
Okay, so these medications are generally considered safe and many purchase them without a doctor's prescription. But if you're at an increased risk of heart attack or even stroke, we can't stress enough that you should consult your doctor specifically trained in pain. And they can properly diagnose the problem and prescribe proper pain medications accordingly. Now, some people experience a kind of pain that lasts longer, and this could be due to a health condition or even an injury. And finding ways to deal with the chronic pain can significantly improve your everyday. More after a short break. Keep it here on MedTalk Health Talk, only on CNN Philippines. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. One of the most common types of chronic pain is low back pain, because low back pain is actually the leading cause of disability around the world, with as many as 80% of Filipinos reporting back pain at some point in their lives. Dr. Glennis, anong pagkakaiba ng chronic back pain as opposed to yung acute pain, yung meron lang binuhat ng mali and then sumakit yung likod niya?
Also caused by overuse. So as we mentioned earlier, pag we do overuse our muscles due to exercise or during our work, pagbubuhat palagi or pag-strain ng ating muscles, doon nagkakaroon ng pain. And then we try it with some form of over-the-counter medications, but over time, we will notice that it doesn't help anymore.
Okay, now while anyone can develop back pain, even children, there are some factors that puts you at increased risk for it. Dr. Pinay, what are some of these factors that is important for our viewers to know?
So, important factors that we need to address is the body weight. So we have to maintain ideal body weight. So if you have healthy body weight, you have less pressure on your spine, so that decreases your risk of having low back pain. And also, the way we use our body, we have to use it properly, using proper ergonomics. So the way we sit, the way we stand, the way we walk, the way we move, there's a proper way of doing things, even the way we lift. And also our diet, we need to take more calcium, because osteoporosis, or weakening of the bone, is also a factor for low back pain. And also hydrating with lots of water, because when we are dehydrated, the disc that is in between the bone can be dehydrated and it would break down. So hydration is also a factor.
Now, if you do have chronic low back pain, there are several lifestyle changes you can make to address this pain, as well as medication options. Now, Dr. Glennis, when someone comes to you and complains of having, a constant pain in their lower back, what is your initial approach? How would you initially treat this?
Of course, I have to ask where the pain was felt, get the history, and then do a physical exam. And then from there, order the necessary tests, whether it will be an X-ray, an MRI, or CT scan. But during my physical exam, mostly if I can see those tensions in the muscle, we address and give them some muscle relaxants to help them ease the muscle pain. If it's a nerve type of pain, I also give anticonvulsant medications for neuropathic pain.
Okay, now exercise and physical therapy is the best treatment against chronic low back pain, but knowing what the right exercise for you is key. Now, Dr. Pinay, what exercises are usually recommended for those with chronic low back pain?
In general, for chronic low back pain, aerobic exercise would be helpful to decrease low back pain, and also it would help reduce the weight of the patient, and thus reducing the pressure on the spine, and in the process reducing also the back pain. And also abdominal exercises, back exercises that helps strengthen and support your spine would also be helpful. And flexibility exercises, if there's some muscle spasm, muscle tension, would also be helpful.
Now, since we've been talking about chronic pain and low back pain, one of the most talked about treatments nowadays is the use of medical marijuana to address chronic pain. Now, studies show that more than 62% of people who use medical marijuana do so to treat their chronic pain. Now, to make everything clear, medical marijuana is still not approved here in the Philippines, and there is a difference between medical marijuana and that of recreational marijuana, which is illegal. So you must know the difference between the two. Now, Dr. Glennis, what is our current information now when it comes to medical marijuana?
The medical marijuana, of course, should only be used in a medical type of setting. The components of marijuana itself, we take out the psychoactive component, the one that makes us high, and concentrate more on the one that calms us and decreases our pain.
And with that, I'd like to thank rehabilitation medicine specialist Dr. Filipinas Ganchon and anesthesiologist Dr. Glenis Nokongfong for being with us here today. We hope our conversation was helpful to a lot of our viewers. And we want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and we'll see you again next time here on CNN Philippines. Stay safe, everyone.